Hey, this is Dr. Kingery. I want to talk some about the coronavirus COVID-19 just because I continue to see, like everyone else, lots of information and bad information on social media as well as in news outlets. I want to talk about that some because it continues to be a problem, of course, throughout the United States or throughout the world, but also we continue to have that misinformation. So I want to talk about some COVID-19 or coronavirus. Discovered late in 2019 as a novel virus. The reason why we call it novel is because that particular strain of coronavirus has not been seen in humans before. The question always was, when it first came out of China, what's going to happen? Is this something we really need to worry about? Is it going to spread places? Is it going to be a significant virus that's going to cause illness or deaths? Unfortunately, we now know that that's the case. It has been spread very easily. It has been spread worldwide, thus the pandemic. We also know that it has a pretty significant mortality rate. And I want to talk about that for 1 minute. The mortality rate is something that people talk about and say, oh, well, it only has maybe 2.5 to 3% death rate. So, 97 to 98.5% of people are not going to die. There's two problems with that. One is, let's think for a moment of the world population, or the United States population even. And we think about that death rate. Currently in the United States, it's around 2.5% of cases that people die. Compare that to influenza, which people love to compare this to influenza. It's not any worse than the flu. It's just another flu. It's not that big of a deal. Okay, so the seasonal flu usually has a mortality rate of 0.1% or less versus the coronavirus, which is 2.5 to 3% mortality. People think, well, it's those who are have all these medical problems, who are older and are having issues. Why the big deal? Well, again, those are lives. Currently, we have over 160,000 deaths in the United States attributed to COVID-19. There's conspiracy theories out there, of course, of, well, everything gets tagged as COVID-19 if we don't know the death. First of all, that's not true. Second of all, we know that people with diabetes and heart disease and cerebral vascular disease, etc., don't just die. If they have COVID-19, does that make them more susceptible to death? Yes. Would they have died without COVID-19? Possibly not. We'll never know the true answer, because maybe they were sick enough otherwise, but the fact is that COVID-19 is causing significant harm in these patients. It's affecting younger populations. In fact, we see a trend now from, it's not so much the elderly population now that's having a significant issue or increase in numbers. It's the younger population, middle-aged, young adults, and children. People walk around all the time with no symptoms, so we think, well, it can't be that bad. If that's all that you see is a little bit of a cough, you feel kind of run down, then it's no worse than the flu. First off, we already said it's worse than the flu. Mortality rate is much greater. We even look at 2009 flu pandemic, H1N1. People like to compare this and say, well, what about H1N1 pandemic? We didn't have to go around wearing masks and things then. That's fine. Let's think about it for a minute. Let's compare it. So in 2009, H1N1 influenza was a pandemic that hit. We had 12,469 deaths in the United States. And yes, some of those were probably people who had influenza and comorbidities, other medical problems that the flu happened to kind of push over the edge, like some people argue coronavirus does, which is probably true. 12,469 for flu season. Pretty significant. Everyone likes to talk about it. We have 160,000 deaths in the United States already from coronavirus, which we have had for 8 months, as far as we know. So think about that for a minute. How many deaths is that? Now, here's my biggest concern with this. We have a mortality rate of 2.5 to 3% of coronavirus cases in the United States, already killed 160,000 people in the United States alone. Flu season is 1 to 2 months away. Think about the problem that creates. We have coronavirus, COVID-19, causing significant harm while we are getting into flu season. So we're going to be dealing with whatever flu strain hits along with COVID-19. Some people will probably end up getting both. And that's where I really worry. When we talk about all the people walking around with no symptoms or very few symptoms and they test positive for COVID-19, think if they had some other illness on top, such as influenza. We're about to hit seasonal cold season as well. So we're going to be dealing with that as well. So when we really think through all this, we've got a real problem possibly in a month or two. We would love to see COVID-19 flatten out and have decreased cases. Unfortunately, that's not the case. Maybe we're there in some places. Maybe we're there in some states. But we still have a significant number. People argue, well, there's all these asymptomatic patients or those with symptoms that have very few problems. Unfortunately, two problems exist with that mostly. One, we are learning more about COVID-19 and over time are seeing that these asymptomatic patients or those who had mild symptoms or those who had severe symptoms who have recovered, if you will, are continuing to have problems. They're continuing to have respiratory problems. They're continuing to potentially have cardiovascular problems. In young kids and even young adults, we're seeing that it's affecting blood clotting. So people are having microvascular clots. What will that show over time? Right now, we don't have a cure for COVID-19. Data has been done out there and looked at in some of the studies. The problem is we have a virus we've been dealing with for 8 months. Think about the flu. We've dealt with that for over 100 years. We know a lot about influenza. Yes, it changes every year. Yes, it has a new strain or potentially a new strain every year. But it's still the same type of virus. Lots of data, lots of information behind influenza. Some medication that can help decrease symptoms and duration of influenza. And certainly we have vaccines. We have none of that for COVID-19. We know that steroids help to some degree in those who especially are severe cases of COVID-19 because COVID-19 has a huge inflammatory response behind it. In fact, that's the main way that it affects people. It's all of the inflammation that occurs in the lungs and in the vascular system that's causing its effects. So steroids help in some cases. The better studies out there show that hydroxychloroquine, even combined with zinc and azithromycin, does not benefit. There are some poor studies and poor data out there that say perhaps it does, but the good data we have shows it does not. Will that hold true in another 4 months or a year? Don't know. Maybe we'll have more data that is good data that says it does work. But we also know it has lots of side effects. And if we were to give that to the masses, obviously we're going to have a number of people who have reaction. People say, well, the side effects are rare. It happens in 1% or 5%. Okay, fine. But if we multiply that out and just start giving everybody who gets COVID-19 that medication, will we continue to have an increase in problems? Of course. So when we think through that, that's one of the things we should be thinking about as well. All right. So why are masks important? Masks decrease respiratory droplets. If I cough, if I sneeze, if I talk really loudly, I emit respiratory droplets. When those respiratory droplets come out, they have some viral particles in them. I don't tend to spew out one viral particle at a time all by itself. Viral particles come in clumps. They come in respiratory droplets. So the mask is a barrier that prevents that from going any significant distance. Even if it does make it through the mask, it's going to drop pretty quickly and not go a good distance. So masks help prevent that from happening. Then social distancing comes into play because we believe that 6 feet is a good range with a mask on, especially that those respiratory droplets won't reach the other person. And again, we already talked about influenza season is coming up very, very soon. If we add COVID 19 on top of influenza, we're going to have a huge recipe for disaster. So, what do we do? Unfortunately, it means that we continue to wear a mask, we continue to socially distance, we get our flu vaccine as soon as it's available to help prevent the flu, and then we continue to watch out for symptoms. People are frustrated with COVID 19. I agree. I'm frustrated too. I think we're all frustrated. We wish this had never happened, of course. Currently, over 160,000 people in the United States have died because of COVID 19. And maybe it wasn't COVID 19 alone in every single case, of course. We talked about that. But would those people have died without COVID 19? Most probably would not have. Let's mask up. Let's continue to socially distance. The key is waiting on a vaccine. That's one thing I'll address too, is the immunity. So people talk about, well, if I get COVID 19, at least then, hopefully it'll be mild and I will have immunity to COVID 19 going forward. So I won't get it again. It won't be so bad the next time. Let's just go ahead and get this over with. People refer to herd immunity. Okay, that's great, except two problems. One is we don't know in every case who's going to become very, very sick. Some very healthy people have become very sick and died of COVID 19. So there's that. The other thing to think about too is that we have data showing that those who have become infected with COVID 19 have antibody responses that go away very quickly. If we get exposed to some viruses like flu, influenza, a lot of times we build a good immune response, and those antibodies stay around a while in order to fight off the influenza later on. So it would be great if, in fact, all of us could get very mild symptoms and get an immune response that lasts. That's the issue. We don't. Again, this is a virus we know about for 8 months. We may find more and more data later on. Maybe there are certain people who get immunity, some people who don't. Maybe it's based on the severity of illness. But what we do see is cases of COVID 19 that do not build immunity even a month or 2 months later. We take patients who have had COVID 19, test their antibodies 1 to 2 months later, and there are no antibodies. That is concerning. Why is that so concerning? Because it means you're not going to be immune if you get exposed to COVID 19 again. So, what's going to happen the next time? The vaccines in development being tested show longer immunity. They show continued immunity. I know there's conspiracy theories around vaccines, all kinds of conspiracy theories, including microchips that are being implanted in people. Trust me, the medical community, we do not sit around trying to scheme ways of coming up with microchips in there. And trust me, Bill Gates has way more money and other things to do with his life than that type of thing. Okay? But what we do see is that we have continued immunity with the vaccines thus far. Hopefully by December or January, we will have a vaccine that is safe and effective. I will be one of the first ones lining up to get it because I want this to be over with just like everyone else does. Until that time, we won't be over this. And in fact, until we get a significant amount of people vaccinated, it probably won't be over either. This won't just go over in November. This won't just go over when it gets really cold outside. We know that this virus is pretty resistant to temperature changes while it's in a host, a person. Outside of that, heat, cold seem to affect it, but when it's transmitted from one person to another person, it's not going to be affected very much by that. Think about where it came from, Wuhan, very, very hot climate at the time in particular, and it survived very well. So, back to what do we do in the meantime and why do we worry about it? We have over 160,000 deaths thus far. We've had this virus for less than a year in the United States, as far as we know. It kills people who have not had any medical problems. It causes lifelong, potentially, at least 2, 3, 4 months out from it. Again, we've only had it for 8 months. People continue to have problems. So, mask up, keep your distance, let's look out for each other. Having a mask on protects you, it protects others, and quite honestly, it shows respect. And I know some people don't like to hear that. People frown on, oh, I'm not showing respect because I'm not wearing a mask. But I can tell you that when I see people in stores wearing a mask, it really tells me you care. And I appreciate that. As a physician, I really appreciate that. Let's take care of each other. Let's hope the vaccine proves safe and effective as it has thus far, and that it has long immunity. Let's hope in December, January, we can start getting over this and put things behind us and move back to true normal, not a new normal. I want to get rid of the mask too. I want to get together and hug people, and I want to do fun stuff. If it means that we save lives, why shouldn't we do that? If it means it saves our neighbor's life, if it means that it saves some other person's life that we've never met before, but we passed them in the grocery store, shouldn't we try to do that? We're all human beings. Why aren't we taking care of each other? We should take care of each other. I appreciate those who tuned in. Hopefully this helps answer some of the questions and gives some insight into why do we really worry about this as physicians. Again, this isn't just the flu. It's much more deadly. And unfortunately, it's probably going to have significant long-term problems, even with those who have mild symptoms when they get infected with it. So take care, stay safe. Let's look out for each other.